If you're over 60, what I'm about to tell you might shock you. After speaking with countless healthcare professionals, digging into real patient stories, and uncovering what doctors often whisper behind closed doors, I discovered some disturbing truths. The reality is this: when it comes to seniors, the healthcare system doesn't always deliver the respect, attention, or quality of care you deserve. In fact, there are hidden biases and unspoken assumptions that could cost you not just your dignity, but years of your life. One retired physician even admitted to me, it's the industry's worst-kept secret. And once you hear these truths, you'll never walk into a medical appointment the same way again. What I'm about to share could change your health journey forever. Welcome to Motivelux, where we uncover the realities no one dares to speak about and give you the tools to take back control of your life. Today, we're exposing 5 brutal truths about medical ageism, truths the healthcare establishment doesn't want you to know. But don't worry, it's not just about the problems. I'll also share proven strategies that smart, empowered seniors are using to flip the script and demand the care they truly deserve. First, the mental shortcuts doctors make the moment they see your age. Second, the financial pressures that quietly shape treatment decisions. Third, how dangerous stereotypes distort the way your symptoms are understood. Fourth, the prescription practices that are more about control than healing. And fifth, the heartbreaking assumptions about your mind and memory that silently affect your diagnosis. But here's the empowering part. Once you know the game being played, you can change it. If you've ever felt dismissed, rushed, or spoken down to by a doctor, stay with me, because by the end of this video, you'll know exactly how to make sure that never happens again. And before we dive in, hit that like button and subscribe with notifications on, because what you learn here could literally save your life. Let's begin. The first reality is this: many doctors mentally label you before you even open your mouth. The second your age shows up on their chart, you're quietly categorized as a complicated or high-maintenance patient. This isn't necessarily malicious, it's the way medical training conditions them to think. Older adults are seen as requiring longer appointments, more tests, and more medications. By the time you sit down, their mind is already calculating how much time, effort, and money you'll cost the system. And when you add in today's economic pressures, declining insurance reimbursements, patient quotas, and the push to move quickly, it only makes things worse. Studies show doctors spend up to 23% less time listening to patients over 65 compared to younger patients with the exact same complaints. That's nearly a quarter less attention, simply because of age. Take Maxine, a 74-year-old retired librarian. She carefully tracked her symptoms for weeks before an appointment. But when she tried to explain them, the doctor cut her off almost immediately. "Let's just focus on your main concern." Her chest pain was brushed aside as stress, only for her to be diagnosed with heart disease 6 months later. Those 6 months could have cost her everything. But here's the good news: you can fight this bias. Start your appointments by clearly stating your goals. Don't just say, "I feel tired." Say, "My energy has dropped by 40% over 3 months, and I want to find out why." Bring a 1-page health summary that shows you're proactive. Request specific follow-up times to go deeper into issues. And always take notes in front of your doctor. The moment they realize you're paying attention, their behavior changes. They see a partner, not a problem. The second truth is what I call polite medical gaslighting. Seniors all over the world hear the same dismissive phrases, "That's normal for your age. We all slow down eventually." These lines are used to brush aside symptoms that, in younger patients, would trigger urgent testing. And the impact is devastating. Research shows that 85% of serious conditions in seniors are first dismissed as just aging. Heart disease is mistaken for fatigue, cancer for wear and tear, depression for adjusting to age. Carl, a 67-year-old former construction supervisor, knows this too well. For 8 months, his doctor told him his joint pain and fatigue were normal for his age. When he finally demanded blood work, it revealed severe rheumatoid arthritis, damage that could have been prevented if caught earlier. The defense? Don't accept vague reassurances. Ask for specifics. What percentage of people my age experience this symptom? What tests would you order if I were 40? Present timelines that show sudden changes, not gradual decline. And if possible, bring an advocate, a friend, a family member to appointments. Doctors act differently when someone else is watching. The third ugly truth is about assumptions of mental decline. Too often, doctors assume seniors can't understand complex information or follow detailed treatment plans. They oversimplify explanations, withhold advanced options, and default to easy but less effective solutions. Look at Louise, a 71-year-old retired chemistry professor. When diagnosed with breast cancer, her doctor recommended the simplest surgery, skipping over modern therapies and reconstruction options. His reason? At your age, we want to keep things straightforward. Louise had to fight for months to access the same treatments younger women were offered immediately. The solution? Prove your capability from the start. Tell your doctor, "I managed complex projects for decades, please give me the detailed information so I can make informed decisions." Ask for medical terminology, request written treatment plans, and use technology during your appointments. The moment you demonstrate engagement, the assumptions start to crumble. The fourth truth is perhaps the most disturbing. Medications are often prescribed as a form of control, not treatment. Seniors are disproportionately given sedatives, antidepressants, and mood stabilizers, not always because they need them, but because they make patients easier to manage. It's called chemical restraint, and it happens more often than most realize. Beverly, a 69-year-old retired school principal, experienced this after hip surgery. Frustrated with her recovery pace, she began asking questions. Instead of answers, she was given anxiety medication. The drug caused confusion and balance problems, leading to a fall that broke her wrist. What was meant to calm her ended up extending her recovery by 4 months. To protect yourself, always ask, what exact condition does this medication treat? What measurable outcome will prove it's working? Research every drug you're prescribed, request medication reviews, and set timeframes for reevaluation. Never accept vague justifications like for anxiety without proper diagnosis. Finally, the fifth and most heartbreaking truth, the system quietly assigns less value to your life. Behind closed doors, doctors and insurance companies use economic formulas to decide which treatments are worth it based on your age. The same surgery offered to a 40-year-old may be denied to a 70-year-old, not because it won't work, but because the system calculates fewer quality years remaining. Walter, a 68-year-old engineer, lived this reality. Diagnosed with kidney failure, he was told dialysis might not be appropriate at his age. He fought back, insisted on treatment, and lived another 7 active years. 7 years the system was ready to take from him. Never forget, your life has equal value at 70 as it does at 30. Ask, would you recommend the same treatment if I were younger? Demand evidence, seek second opinions, and don't accept age-appropriate limitations. You have the right to every option available, period. Now you know the 5 ugly truths about medical ageism. But more importantly, you know how to fight them. Knowledge is power, and you now have the tools to walk into every appointment as an empowered advocate, not a passive patient. Every time you push back against dismissive comments, demand evidence, or insist on equal treatment, you're not just protecting yourself, you're changing the system for everyone. Remember Walter, who gained 7 extra years by refusing to accept no. Remember Beverly, who stood up to medication misuse. These aren't rare exceptions, they're proof that when you take control, everything changes. Your health, your dignity, your life, it's too valuable to hand over to stereotypes. Fight for it. Protect it. Demand it. If this message resonated with you, hit that like button right now, share this video with every senior who deserves better treatment, and subscribe to Motivelux for more truths the system doesn't want you to hear. Tell me in the comments, have you experienced medical ageism? And what will you do differently at your next appointment? Together, we can create a movement that forces healthcare to treat seniors with the respect and dignity they've earned. Because your age should never define your worth.